Okay, well, I'm hoping that people can hear me. Can someone just send back a quick comment in the chat box to the entire audience to let me know that I'm online? Great. Thank you. Thank you for that welcome, and welcome to everyone to today's webinar. Today's webinar is to help describe the history and the content of the Pan-Canadian Health Promoter Competencies on behalf of Health Promotion Ontario, as well as the Pan-Canadian Network for Health Promoter Competencies. So I want to start by thanking you for attending today's webinar because at HPO, professional development and advocacy are a part of our core mission. And so by participating today, you're actually helping us to fulfill at least two of these pillars. We'd also like to thank the OPHA for giving us the opportunity infrastructure to conduct the webinar today. It's a great opportunity for us. So my name is Kathan Shankerdat. I'm moderating the webinar today, as well as giving you some background on Health Promotion Ontario and the field of health promotion, joined by promoters, Manager of Health Promotion at Lambton Public Health, nestled between Lake St. Clair and Lake Huron there. And he'll be telling us about the rationale for and the history of developing the Pan-Canadian Health Promoter Competencies. And he will also walk us through the competencies that have been developed. Rebecca Fortin is a health promotion advisor at Peel Public Health, and she'll be offering a case study of how the competencies have been used at the level of the workplace in Peel Region. And Jaspreet Kaur is a recent transplant to Peel Region Public Health as a research and policy analyst, so congratulations to her. And she'll be offering a case study of how she, as an individual health promoter, has used the competencies. So we hope that this will give you a nice overview of not only the rationale and the history for the health promoter competencies, give you some information about what the competencies are, but then also how you might make use of them in your own practice. Now, in introducing ourselves, I've basically just described our agenda, but there's one part left to mention at the end of the webinar. We will have time to have some discussion on questions raised by you in the audience. These are questions that you might have submitted in registering for the webinar, or they might be questions that you think of during the webinar. And we'll actually be prompting you with some questions throughout today's webinar. And what we would like you to do is to use the chat box. It's usually located on the right-hand side of your screen, just below the list of participants. And you can enter in responses to questions in the chat box. Make sure they're directed to all entire audience. And I'll do my best to gather responses to questions that we pose throughout the webinar, and then at the end try and facilitate some discussion based on those questions and responses. A bit of information just to start off. We did get a bit of feedback in terms of who is on the call today, and I thought it would be interesting to share that with all of you. 63% of participants who were registered as of, I believe it would have been about yesterday morning, are from public health. 11% identify as community health. These would be practitioners in public health and community health. About 9% from research and academia, about 3% from government, 7% from the not-for-profit sector, 1% from private industry, and 6% of you identified as something else. So let's get started, and we're going to start with a question. And so the first question for you is, why did you register for this webinar on health promoter competencies? I'm just going to fill that question in the chat box. And we want your responses because this is going to help us understand who might be interested in the core competencies, which will help us assess whether the resources that have been developed are adequate given the pool of potential users. And it might even be interesting to report back to all of you just to see where you fit in. So if you have a response to that you'd like to offer, please enter it into the chat box. Okay, so let's start with the foundations of Health Promotion Ontario as an organization, because we've been involved in developing the Health Promoter Competencies, and we think it would be interesting and informative to trace that genesis back to the origins of our organization. So in 1987, a small group of public health unit staff formed what was then called the Association of Health Promotion Specialists in Ontario. This eventually became Health Promotion Ontario. Over the years, we've grown in size while remaining a dedicated group of health promotion professionals in maintaining our mission to advance the critical importance of health promotion and its practice through professional development, membership, member communication, and advocacy. The formation of this group in 1987 was initially spurred by the release of the Lalonde Report in 1974, which really put health promotion on the map in Canada, as well as the declaration of the Ottawa Charter for Health Promotion in 1986. In particular, the Charter launched the expansion of health promotion as a field of practice and laid the groundwork for most health promotion work that has taken place since then. Health promotion practice has since encompassed the action areas of the Ottawa Charter, which are building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. In addition, the Charter introduced some very powerful concepts to the discipline that are still used in everyday health promotion practice, such as the need to empower individuals to be able to live healthy lives, the need to advocate for health promotion in a world where it won't always be politically attractive, the pursuit of fairness in health outcomes, or what we often discuss as equity these days, and the need for community engagement to facilitate meaningful health promotion. Now, at the beginning of the organization, Health Promotion Ontario was focused on establishing a newsletter, coordinating semi-annual meetings, and drafting a constitution. Over the years, we've established ourselves as a constituent society of the OPHA and the Association of Local Public Health Agencies, better known as ALPHA. We also have highly valued partnerships with Public Health Ontario and the Ministry of Health and Long-Term Care. Health Promotion Ontario has played a role in many public health initiatives over the years. We've presented a resolution for the continuation of the Healthy Community Partnership, commissioned a paper which urged the government to provide leadership and a vision for health promotion, as well as convene a panel of health promotion experts to work on a multi-sectoral approach to complex public health issues such as childhood obesity. Health Promotion Ontario also participated in the Public Health Capacity Review in 2005 and also joined forces with OPHA to co-sponsor 2 fall forums more recently, focused on the built environment and local food systems, and engaging with priority populations. Most recently, we've drafted our own new strategic plan, and we've started to embrace the world of social media. So hopefully you start to see a little bit more from Health Promotion Ontario in the coming years. I know that, as evidenced by the data on who participated, many of you are health promoters in attendance today, but some of you may be students just learning about health promotion, or may not be from health promotion but interested in health promotion, and so you might be wondering exactly what health promotion is. So I just wanted to talk very briefly about that. According to the Ottawa Charter for Health Promotion is the process of enabling people to increase control over and improve their health. In building on the notion of empowerment, this definition emphasizes that both social conditions and personal actions determine health. This is what some sociologists have referred to as the relationship between structure and agency. So health promotion actions move beyond focusing solely on individual behavior change and also focus on a wide range of social and economic interventions and influencing issues. the emergence of health promotion as its own specialty within public health has given rise to debate surrounding how to define the scope of public health, health promotion practice, excuse me. One key aspect of this debate concerns the development of health promotion competencies, which have been defined as a set of skills and knowledge necessary to be effective while practicing health promotion. These competencies needed to be developed so as to inform health promoters, to inform those employing health promoters, and to those training and educating health promoters, say in the academic sector, about what the necessary skills are to be effective in the workforce. Okay, so I want to move us towards a second question, and thank you to all of you who have responded to the first question there. The second question is, in your opinion, how could discipline-specific health promoter competencies support the practice of health promotion in Ontario and Canada? Now, Kevin Churchill is now going to go on to talk about the rationale for the competencies and describe what the competencies are. So if you don't have an answer to this point just yet, you might think of one as Kevin walks through the material. And I'm going to hand over control. Okay, good.
Okay, thank you. Thanks, Caden, for setting the context. And my job over the next few minutes will be to summarize the development of the health promotion competencies, which had their humble beginnings in Ontario. Some of this will be ancient history to many of you, but it's helpful to remember and remind ourselves that it all started with a virus. The SARS outbreak of 2003 was really a pivotal event that forever changed the shape of public health in Canada. And the reports that were generated were many by Naylor, Campbell, and Walker, etc. And it almost unanimously called for a complete overhaul of the public health system in Canada, including recommendations to strengthen the public health workforce, which in turn led to the creation of the Public Health Agency of Canada. And it was really the agency that started this wheel rolling. One of the first tasks undertaken by the agency was the development of the core competencies for public health in Canada. And those were released in 2005, and as many of you know, these competencies set a baseline for all public health workers in Canada, and they were designed intentionally to be multidisciplinary and not the domain of any specific discipline. Not far behind the core competencies, there was recognized that there was a need for the various disciplines to develop specific competencies that would apply to their discipline. So for public health nursing and public health inspectors, epidemiologists, registered dietitians, and all of the disciplines started looking within, and some of the more established disciplines certainly had those kinds of things in place. But the agency was able to create consistent expectations around that and support, more importantly, to support the developmental work, especially for health promotion, who is really a very young discipline, and still is. Being the most firmly established network at the national level representing health promoters, Health Promotion Ontario was approached by the agency to apply for a small grant to do the foundational work towards developing a set of national health promotion competencies. And just before I continue, I'd really like to acknowledge the Health Promotion Ontario executive at the time, and in particular our chair, Gail Bursey, as recognizing this opportunity and pursuing those funding opportunities. And over the next 2 to 3 years, Health Promotion Ontario applied for small pots of funding to commission 3 foundational reports that really form the basis for all of the work that's been done since then. And those reports are listed here. There was a literature review that was compiled by Dr. Brent Malofny in 2006, as well as an environmental scan by Brent Malofny, followed by a discussion paper by Brian Heinemann. And many of you will know Brian from his work with the Health Communication Unit of the University of Toronto and now with Public Health Ontario. Each of these reports built on the previous ones, and they were all important. And it's worth noting that Brian Heinemann's report contained the first version of the actual competency statements. And this report was called a discussion paper, really to indicate the developmental state of these competencies and to clearly signal that they were a starting point and not a finished product by any means. So over the next year, this paper formed the basis for consultations within Ontario in order to test and validate the competencies. And there were adjustments made to them through that process. So even though this work started in Ontario, it was always a clear goal of the agency that the competencies be applicable throughout the country in the various settings and structures. So with the help of the Public Health Agency staff, the Ontario-based group expanded in 2008 to include health promoters from Manitoba and Nova Scotia, and thus the Pan-Canadian Network for Health Promoter Competencies was born. And you see the goal on the slide of the network as defined. I won't repeat that. So next began the work of validating the competencies and trying to test them to see if they would really ring true and be relevant in different setting contexts. So in 2008, the network began this process, and it was on a small scale with our first workshop in Manitoba. This was followed up with a report summarizing the Manitoba results, authored by Marco Gassemi, and this report formed the basis for future funding proposals as well as a revised version of the original competencies based on the feedback from Manitoba and Ontario. And in 2008 to 2012, it was a fairly lengthy period where the group prepared to apply for long-term funding, and I fondly remember Gail Bursey describing it as a bit of our Charlie Brown stage, where every time Charlie Brown goes to kick the football, it gets snatched out from under him by Lucy. And the football being the long-term funding that we really needed to make this work on a national level. So anyways, to make a long story short, it was difficult to sustain a national network over this period, but we did manage to keep plugging along. And again, thanks to the efforts of people like Gail and Rebecca Fortin, who also joined us in 2011. And Rebecca is on the line, and you'll hear from her soon. But she was the person who really helped us develop the proposal that ultimately was a successful proposal to the Public Health Agency that gave us a long-term funding to continue. So just when all hope was almost lost in 2012, late 2012, the network received the federal funding approval to continue validating the competencies across Canada and to expand the network. And this was a substantial grant provided under the Public Health Workforce Development Products and Tools stream of funding. There was an RFP process for the project manager position, and Dr. Brent Malofny, who I mentioned earlier, was a successful bidder for this work. And Brent is well positioned to do this, given his extensive knowledge of public health networks in the country and his previous work on competency development. And Brent reports to the National Steering Committee, and he's been very busy. Currently, consultation is occurring to validate the draft set of health promoter competencies in several provincial and territorial jurisdictions. There was another consultation in Manitoba, which we completed in 2013. and a session recently in Nova Scotia, which was completed in 2014. And the next task is to do 2 additional consultations in different provinces, and we're currently in discussions with Alberta, and so we hope that Alberta is the next on the roster of presentations. So the next 2 slides present the actual competency statements, and these are in draft 4.1. And while the slides give you the main competency statement, I'd like to note that and invite you to look at the whole set of statements, because they do contain subpoints that go into more detail on each one of these competencies. And if you're familiar with the format of the core competencies for public health, then you'll find that this format is very similar. So I'm going to read out each of the statements and just give you one example of one of the subpoints that helps to describe it in more detail. So the first one being to demonstrate knowledge and skills necessary for health promotion practice. And the subpoint is to apply a population health promotion approach, including determinants of health and health equity for the analysis of health issues. Number 2, to partner with communities to conduct a situational assessment for a specific issue. And the subpoint is to conduct population assessment using existing or collected health data for a specific health issue. Number 3, to plan appropriate health promotion programs. And the subpoint is to develop a plan to implement program goals, objectives, evaluation, and implementation steps. Number 4, to contribute to policy development and advocacy that reflects community needs. And the subpoint is to describe the implications of policy options, for example, health, economic, administrative, legal, social, environmental, political, and other factors as applicable. So hopefully some of these statements are ringing true for folks on the line who work as health promoters and reflects what they do. I'm going to go to the next slide. Number 5, to facilitate community mobilization and build community capacity around shared health priorities. And the subpoint there is to develop relationships and engage in a dialogue with communities based on trust and mutual respect. Number 6, to engage in partnership and collaboration, which includes establish and maintain linkages with community leaders and other key health promotion stakeholders, for example, schools, businesses, faith groups, community associations, organized labor, etc. And then the last statement, to communicate effectively with community members and other professionals. And the subpoint is to provide health status, demographic, statistical, programmatic, and scientific information tailored to specific audiences, for example, professional, community groups, and general population. So those very quickly and at a very high level are the competency statements as they exist today. So I'm going to go to a question. So based on this information, how do you or how could you use the existing health promoter competencies in your practice? So I'll invite you to think on that, and I'll move to the next slide. But please put your answers in the chat pod, and we hope to have time to come back to these. The next slide talks about the national network. And one of the deliverables for the agency-funded project was the establishment of a national network for health promoter competencies. And this group has been established. It certainly doesn't have representation from all of the provinces at this point, but the goal is to pick up reps as we go along and validate the competencies in the different provinces. So at this point, we have good representation from Ontario, and we also have representation from Manitoba and Nova Scotia, and adding members from other provinces as we go. The group meets by teleconference on a regular basis and acts as a reference group and a steering committee for this project. The other goal is to establish linkages to establish health promotion networks in other provinces. And so Health Promotion Ontario obviously being one of those, which we have strong linkages to, as well as Nova Scotia's Health Promotion Clearinghouse. And something else that we hope is an outcome of the project is supporting the development of health promotion networks in other provinces. And certainly we have some experience with that, many of us having been involved with Health Promotion Ontario for many, many years, and hope to provide some mentorship. One of the other important outcomes or products that we will be delivering with the project is a toolkit. And as the name suggests, it will contain tools and resources that will be developed for not only health promotion practitioners, but potentially for managers and HR departments and employers that could be used for hiring and staff development to help identify training needs, and also educational institutions and universities for the purpose of curriculum development. And certainly we know that they're currently being used in that means by the University of Toronto, for example. So some of the other or some of the tools that are currently in the toolbox include the competencies themselves, as I've just described, as well as the Health Promoter Competencies Glossary, which is a bit of a, as the name suggests, a consensus on some of the terms and their meaning. And some of the other tools under development will include sample job descriptions and interview questions that could be used for hiring or recruitment purposes. So I'm going to go to the next question. So you've heard a little bit about what some of the tools are, and we'd like to get your feedback on what kinds of tools or resources or supports does the field need to use the health promoter competencies. So I'm going to invite you to think about that, and I'm going to pass the microphone over for some real-world examples, and we're going to hear from Jaspreet, and she'll talk about her experience with the competencies from really a reflective practice perspective. So over to you, Jaspreet.
Thank you, Kevin. I'm just going to try to change the slide, and there we go. Okay, so good afternoon, everyone. As mentioned, my name is Jaspreet Kaur, and I am a research and policy analyst with the region of Peel. Prior to this role, I was a health promoter with the Middlesex London Health Unit. So I will be talking just for a few minutes about my experience with using the competencies with a specific health promotion project in my previous role as a health promoter, some of the questions that the competencies helped us answer while developing the project, and really to show you how you may already be using aspects of the competencies. So the project I will be talking about is an in-school fluoride varnish program, and we began with the first competency, which Kevin mentioned states as a health promotion professional, you should be able to demonstrate knowledge and skills necessary for health promotion practice, which includes being able to apply a population health promotion approach, taking into consideration a health equity lens. So with this, we had to ask ourselves, specifically for the project we were working on, where in the community are we seeing the highest rates of tooth decay amongst school-aged children? And how does that align with the demographics of the community and the social determinants of health, such as income, education, accessibility to services, and among other factors? So another important component of this competency is to be able to describe the range of interventions that are available to address population and public health issues. So we had identified the communities and schools in greatest need, but what do we do now? We could have done educational sessions on good oral health hygiene, school presentations, introduced a school-based toothbrushing program, or a school-based fluoride varnish program. So really, there were numerous possibilities for interventions and for this health issue. But with the second competency, the feasibility and appropriateness of interventions can be assessed by conducting a situational assessment for a specific issue. So here we started with conducting a literature review to find out what are the best health promotion strategies when addressing high rates of tooth decay among school-aged children, specifically in low SES neighborhoods. And this was coupled with an environmental scan to find out what other public health units, especially in southwestern Ontario, were doing for the same group in their neighborhoods, and what their challenges and successes were with their interventions. So this approach of an environmental scan along with a literature review helped to lead the project into the direction of choosing to implement a school-based fluoride varnish program. The third competency of planning an appropriate health promotion program is one that I'm sure is most familiar to health promotion professionals because it includes planning the goals, objectives, implementation, and evaluation steps for the program. So here we would be creating the logic model, the Gantt chart, assessing what will be required from staff time, materials, resources, and really the logistics and fine details involved in a health promotion project. This competency also involves putting together what your short-term and long-term objectives will be. So for us, it included a short-term objective of providing fluoride varnish to 50% of eligible children within the first year of the program, and then a long-term objective of improving school tooth decay rates over a 5-year period. So these are just some of the ways that the core competencies were used to help guide the planning and implementation of a fluoride varnish program in my previous role. But the core competencies are also an important component on reflecting where there may have been areas of the project that could have made greater use of health promotion principles. So for example, reflecting on this project, we can see now that there could have been greater opportunities to utilize aspects of competency number 6, which talks about engaging in partnership and collaboration, which could have involved school staff and school principals involved in the fluoride varnish program. I'd also like to mention that the health promoter competencies are by no means a checklist or one-size-fits-all approach. There will be many cases where in your capacity as a health promotion professional, you may not have the time or resources to apply all the competencies to a specific project, and sometimes it might not always be necessary. Your work with the competencies may also come in transitions based on the project you are working on, or even as your role changes within or outside your organization. So I had mentioned earlier, my previous role was working as a health promoter, and in that role and with the health promotion projects I had worked on, a large part of my focus was on the core competencies I have just discussed, which focused on program planning and implementation. Now that I have moved into another role with another organization, my work with the competencies has transitioned, even though the word health promotion isn't necessarily in my occupational title. My focus now has moved over to competency number 4 primarily, which talks about contributing to policy development and advocacy. So here I'm asking different questions, even about the same project, such as what implications can the success of this initiative have on a municipal or even provincial level? What does a cost-effective analysis of treatment versus prevention or downstream versus upstream show us? And really, how do we get these important issues on the agendas of policymakers? So this goes to demonstrate that working with the health promoter competencies really does require a step-by-step process and can be done so through phases or transitions through your roles as health promotion professionals. So I will now pass it over to Rebecca, who will provide a workplace level perspective on using the health promoter competencies. So over to you, Rebecca.
Okay, thank you very much, Jaspreet, and thank you for sharing your experiences. I know on a webinar setting like this, it may be a bit nervous to do that. So thank you for being vulnerable and sharing your experiences with us. And also thank you to Keaton and to Kevin for providing the foundation and the background context for us. So a little bit about me. I am a health promoter with a master's in health promotion from the Dalla Lana School of Public Health in Toronto, and currently working as a policy and research advisor for Peel Public Health. So I see on the line many of my colleagues who I've trained with in school and many who I've worked with over the past 10 or plus years now that I've been working in the field of health promotion. And I know that there's a room full of health promoters here at Peel Public Health cheering both Jaspreet and I on. So it's fantastic to have you listening in. So yeah, I've been in the field for about 10 years, and I've worked as a health promoter in a variety of settings. So in government public health with Peel Public Health, and non-government organizations in Social Planning Council, actually as well as with the our Ontario Public Health Association. And I've worked in academia as well with the University of Waterloo and the University of Toronto. But no matter where my career has taken me or will take me, and whether my role is explicitly titled health promoter or otherwise, I will always consider myself a health promoter and a health promotion professional. So as a result, I'm very passionate about health promotion and this work in developing the health promoter competencies to support the field and the workforce across Canada. So from my perspective, health promotion requires sophisticated skills, both hard and soft skills, that both you can obtain from formal education as well as from the experience of working in the field. So I certainly believe a strong, robust workforce will lead to more evidence-based and effective programming in public health and within the community, and ultimately better health outcomes for the communities and the populations we seek to support. So I'm passed over the next couple of minutes just to talk a little bit about using the health promoter competencies from a workplace or an organizational level. So as Kevin explained, the health promoter competencies can be looked at as a tool, even though they're currently under development, and in a sense they'll always be under development as the profession evolves and grows over time. They can be used by organizations of all settings, whether it's academia or traditional public health or community organizations, or even health promotion can find its way into more clinical settings as well. So it can be used across a variety of different settings. But I'm just going to go into, from my perspective of my most recent employer of Peel Public Health, and that we've been using the health promoter competencies for several years in our workforce here. And so for those who don't know, a region of Peel sits just west of Toronto, and we cover the cities of Mississauga and Brampton, and also the rural area of Caledon. So we support 1.3 million people in our area. Our health unit staffs about 700 staff in total. So we're we're a fairly large health unit, second in Ontario, and have a lot of opportunity to involve health promotion in our various programs. So here in Peel Public Health, we see them both used specifically as well as generally in our workforce. So specifically, I mean that by in the job titles that explicitly use health promotion practice and theories in their work. So we have a variety of frontline health promoters, and we also have health promoter consultants or specialists. So the analysts like Jaspreet or advisors like myself. And depending on our role, we may dial up or dial down the various competencies or have various levels of responsibilities or technical expertise expected of us depending on our band level. So essentially what Peel Public Health has been able to do is create a non-management pathway for the advancement of health promoters in Peel Public Health, which is a really rare opportunity. I don't think it exists in a ton of organizations, but we do see these different kinds of levels of health promoters throughout various organizations. And then more generally, health promoters can, or the health promoter competencies can be applied as a lens across the various disciplines. So while this adds complexity to the use of the health promoter competencies, it is also a strength. So public health nursing or public health nutritionists, public health inspectors, all can apply the health promotion theories generally within their roles at various levels of intensity to match what is required for their role. So while all of these disciplines have or are in the development of developing their own discipline-specific competencies, you'll see when you look at them, they all contain a thread of health promotion practice generally within their roles. So we see the health promoter competencies like a roadmap, helping us to navigate the individuals through their career pathway. So at the individual level, we undergo performance appraisal processes each year, and staff are able to look to the competencies and see what areas they'd like to develop or what areas that manager would like to challenge that staff person to develop. So for example, for me, I spent the last year on a learning assignment that was challenged to me to develop a fairly large regional partnership in our health unit around active building design. So while we've been looking at the area of land use planning and healthy built environment for several years, we hadn't really specifically looked at the site design and the building design and looking at architecture and how that can either support or not support health. So I was challenged to take a year and really develop the partnerships that needed to be developed to support that initiative. And because it was receiving attention from council and senior leadership, it really allowed me to focus on a particular health promoter competency and take it from a higher, or take it to a higher level, even though I have been working on partnership development in the past. Supervisors and managers are using the health promoter competencies and by way of incorporating them into their job descriptions and job interviews. So as I mentioned, they're being used specifically for the health promoter roles and the other health promoter related roles like the analysts and the advisors. But also they're being generally incorporated into the various disciplines like public health nurses. So, and as well, the health promoter competencies are being used to assist in the hiring of managers and supervisors who support health promoter professionals in Peel Public Health. And so we're using that as a way to ensure that management, at minimum, has a basic understanding of the role and the value of health promotion and what health promoters bring to a table so that they can support that within their teams. And what we're really excited about is that some of the human resources tools like the interview questions and the job descriptions, we're able to use them as a jumping point for this national project, and we'll be able to use them and pilot test them across our various sites and to be able to finalize and refine them to offer as general job descriptions and interview questions and other HR tools that might be helpful for a workplace. And I see already online that you all have some great ideas of what we could consider as part of that workforce development toolkit. So from there, I'd like to pass it back to Keaton to moderate the last part of the session.
Okay. Let me just make sure. Okay, I believe I'm online. So thank you so much, Jaspreet, Rebecca, and Kevin, for walking us through a little bit more about what the health promoter competencies actually are and how they have been used from a personal standpoint and from an organizational standpoint. And thank you to everyone who's been sending us responses to our questions in the chat box. What I'm going to try and do now over the next 12, 13 minutes is offer a bit of a reflection, but really summarize the responses to the questions that were offered, and maybe raise some other questions that maybe Jaspreet, Rebecca, and Kevin can help us answer. So personally, I've not been involved with Health Promotion Ontario for very long, so this is actually quite informative for me as well. And what I was struck by is how thoughtfully the competencies have been developed and how rigorous the process has been, and I think this really strengthens their validity. And then Jaspreet and Rebecca gave us the sense for how these competencies can serve as a roadmap for different types of actors, including non-health promoters. A roadmap for how these different types of actors can navigate health promotion challenges. So even if you're not formally supposed to be the health promoter, how you can foster a health promotion approach to certain challenges. From a personal standpoint, as someone who's working toward greater health equity in my own work, I really liked how the competencies address so many of the processes and values needed to create a fair health system head-on. So while other health professionals seem to need to integrate a mission for health equity into their work, the competencies really positioned health promoters as the front line for pushing the system toward a fair and more equitable place. So I find a lot of value in them in that sense. I wanted to, before I go into a summary of the responses to our questions, Kevin, I have a question for you. And this is related to a question that was offered at the time of registration from one of our participants. So do you expect that there will be more consultations on these health promoter competencies, or are you basically getting the same feedback across the different settings that you speak to? So is there some plurality in what health promoters in different provinces and territories seem to value in terms of the competencies, or do you think after doing 4 consultations it'll be sort of valid enough?
Excellent question. I can answer that by, in one way by saying that the funding for this project has, a budget to conduct 4 consultations. So we've been to Manitoba, we've been to Nova Scotia, and we'll certainly get to 2 other provinces before the project is complete, and it is multi-year, so this effort and work continues until March 31st of 2016. So that's one way of saying that there will be limits to the amount of consultation that can occur. But the other question there was, what kinds of feedback are you getting, and how much variation is there? We're still looking at reports from Manitoba and Nova Scotia, but I'd like to say at this point there's a lot of consensus on the statements and the competencies as they were written. and we're really not seeing a huge amount of variation in terms of the level of agreement with these competencies as they're drafted now as we move across the provinces. Having said that, we haven't been out west yet. I guess Manitoba is as far as we've gotten, and it will be interesting to see how they play out in places where the system is very different than what we're used to in Ontario. I hope that answers the question partly.
Yeah, that's sort of reassuring in a sense that, I mean, there's probably always going to be more fine-tuning and development that we can do, but it sounds like we've arrived at a fairly consensus set of competencies. Before I go into some more specific questions, let me take some time to summarize the responses to some of the questions we raised today. And I'm not going to name names because it was just too difficult to copy the names as well as the comments, so I'm not trying to exclude credit. But so in terms of why did you register today, I thought there was 3 really interesting responses that highlighted the diversity of reasons why people were here. So someone suggested that the development of competencies might be the next step to professionalizing health promoters in Ontario. So, and I think that's a really interesting observation, because the competencies has these formal and validated professional roles certainly offer a basis for professionalization, further professionalization. Another comment was related to raise the level of legitimacy of health promotion as a valid and useful profession within the health system. So I think health promotion has always, to me, seemed like such an attractive field and such a useful field. But I'm sure I'm not alone in as a very concrete profession in relation to doctors and nurses, or even public health professionals, what are called public health professionals, because health promoters aren't necessarily the same thing. And finally, to ensure that I'm supporting health promoters, somebody mentioned that they were here to ensure that they're supporting health promoters that report to them to maximize the full scope of their role and have the opportunity to apply the full range of competencies. So again, some of us here today aren't health promoters, but work with health promoters. Another question was, in your opinion, how could the discipline-specific health promoter competencies support the practice of health promotion in Ontario? And one response that I thought was interesting was that health promoters are able to join health units ready to take on projects with very little orientation and training, being immediately effective without the prolonged training required for other professions with primarily clinical background. So this speaks again to the fact that in health promotion there isn't a lot of formal training or degrees out there. And so these competencies offer a way to get people started in a more consistent and validated manner, I guess. There was maybe 5 or 6 different types of responses to the question, how do you or could you use the existing competencies in your own practice? And I'll just quickly list these in a bulleted manner. People talked about using them for recruitment of health promoters, training of health promoters, performance management, so seeing whether health promoters are doing a good job in their role and how and why, in which ways they can improve over time. Education about the field of health promotion and the practice, and legitimization or buy-in to the mission of health promotion. The improvement of public health leadership, so public health leaders being able to be better health promoters and foster more health promotion in their fields. And finally, in general, improving the practice of health promotion. So really a lot of sort of useful applications for the competencies. And the last question that I'll quickly try and summarize here is, what tools, resources, supports does the field need to use the health promoter competencies? And so there was a lot of different types of responses, I think, including as I've been talking, so I won't be able to capture those here. But I heard that, people would like to see maybe some performance review guidelines. So if these competencies serve as the basis for how health promoters ought to act, can we translate those into guidelines that, say, human resources or could use to critically assess how well people are adhering to them? A professional college. So, could this, certainly to sort of, as an application of the competencies, it could be in accrediting health promoters in a more traditional way. Ongoing training opportunities would be really useful, and they could be online, people have mentioned. So there's always going to be turnover in the professional field. And this webinar is great, but we need to have this sort of thing happening on an ongoing basis, including maybe a little bit more in-depth training than we've offered today. Suggested job titles. So if these are the competencies, then what are the different specific roles that health promoters can play in the health system? A community of practice, which could be really useful for helping to support health promoters as they figure out how to use the competencies. A full-time equivalence calculator to help public health units optimize hiring. So if now we know what the competencies are, that sort of opens the door to what specific roles health promoters can play within the missions of different public health units, and can we then take it a step further and really help structure the human resources of public health units. And finally, an online repository of resources and templates aligned with each specific competency. So someone mentioned that there's actually a lot of resources out there for health promotion, including from PHAC and the National Collaborating Centers. And can we come up with a clearinghouse for all of these resources and align them with specific competencies? So, for example, how do you do an environmental scan, if that's a competency? I do have a couple of more questions that were raised before the webinar. We have a couple of more minutes, so why don't I offer some of these out there to see if we can get responses. And Kevin, Rebecca, and Jaspreet, before I do that, are there any last words or comments you'd like to offer to this?
It's Kevin. If I may, I wanted to come back to your point about legitimizing the practice. And when I started in health promotion, I remember sitting at a desk as being one of the. There were other health promoters in the organization, but you would trade stories with other health promoters about being. Your job description was perceived as being somebody who, made pamphlets, and I was talking to somebody really not very long ago who, has a master's in public health and is working as a health promoter in a public health unit, and he was expressing his frustration at being assigned to a team and the perception of some of his colleagues was that he was there to really help design communication materials, and it's so much more than that. So I really do think that the competencies will help to bring that legitimacy, and certainly there's a wealth of talent out there, and we really want to help shine a light on it and be as Rebecca said, to really help support public health work. And I think there's a lot of potential for us to do that.
Great, thanks. I'm going to maybe close with a related question to build on that, and then I think we have to wrap it up. But there's been some questions before this webinar in terms of how will the uptake of the competencies be encouraged within organizations. Is there any plan at this point for them to be formally integrated, say, into the work of public health units? And I'm seeing a little bit of chatter towards the end of this in the chat box about that, sort of what are the next steps for formalizing the role of health promotion in public health units. So maybe Kevin or Rebecca, you can speak to, are there plans right now for formalizing how the competencies will be integrated into the health system, or is that something that might come down the line?
It's Kevin. I'll take a stab at responding. The short answer is no. There's no master plan to integrate formally integrate these competencies into systems at the level at the national level, and certainly potentially that if that was to happen, it would need to happen sort of province by province, given the way public health is organized. There's been vigorous discussions and debates about the sort of professionalization and the designation of health promoter. I won't repeat that debate, but it's an interesting discussion, and I think our goal is really to help deliver some competencies that are meaningful, that help health promoters and others describe and understand the work and the value of the work, and whether this eventually leads to some sort of professional designation. I think that's beyond the scope of this project.
Okay, great. Thanks, Kevin, for that response, and it's at least heartening that conversation is happening. Mm-hmm. So I think we're all out of time here. I really want to thank my fellow presenters today, Kevin, Rebecca, and Jaspreet, and again, much thanks to the OPHA and Daniel Cho in particular for helping us to facilitate this opportunity. And thank you for participating. Take care.